6 months ago, I wasn't really able to walk. So I saw Medical Tourism Corporation. And I thought, well, let's have a look. 3 years if I'd gone down this original route with the NHS. So this has taken the process from 3 years down to 3 months.
Did our efforts make a real difference for Ian? Let's find out.
Mr. Ian Beckett is 60 plus years of age. He has been suffering for a long time, a few years now. He hails from UK, England, and he has been under treatment from various doctors in the past for a spinal ailment.
My name's Ian Beckett. I'm a program leader for medical biology. About 10, maybe 15 years ago, I started developing problems that are probably caused by longer term things like playing rugby when I was young. That's a stupid thing for anybody to do, by the way. But it obviously started a problem in my back. And this was compounded over many, many, many years to the point where up until even 6 months ago, I wasn't really able to walk.
So he was getting functional difficulties in terms of pain that he had to tolerate, the distances that he could walk. He was finding it difficult, and he has a great passion for teaching. He was finding it difficult to be sitting for a long time and, focusing on the work that he was doing. He has gone through a few injections in his back to treat the pain as a part of the pain management program, and also did a lot of physiotherapy in the last few years.
I started researching individual doctors, and this was taking so much time. It was driving me mad. And as I was searching for a doctor, I saw Medical Tourism Corporation, and I thought, well, let's have a look.
Thereafter, he got in touch with MTC, who referred them to us in India, along with all his reports and his clinical condition in a detailed document. That document was reviewed by me personally, and I saw his history, and I could make out that it was the L4-5 degenerative disc which was causing him all the pains that he was enduring. It was decided in his country also by one of his surgeons that if nothing works, then he may require a spinal fusion at L4-5 level. After having seen his reports, MTC scheduled a video call with him, whereby I had a personal conversation with Mr. Ian, explaining him the situation, and that I do agree with the doctor that he has seen, who has advised him a spinal fusion procedure. However, being a minimal invasive spinal center that we have built up here, and having operated on close to 15,000 patients like him, I would offer him a minimal invasive spinal fusion technique where the procedure stays the same, TLIF, Transforaminal Lumbar Interbody Fusion, but through keyholes. So instead of opening up the entire back and doing an open procedure, which may take longer for him to recover, I offered him the minimal invasive one.
So I researched the surgeon, I researched the hospital, and I found that the surgeon was very well respected. His techniques were fantastic from my point of view, because I'd researched his papers, I'd researched all sorts of things about him, and I looked at those procedures and thought, yes, this is the person I want to go to. I found a person that was going to take me through. There was a car waiting outside, so we were picked up straight away, taken from there straight to the hospital. Immediately had a consultation with my surgeon. I knew exactly what was going on, and I was put in a hospital bed that day.
He was very heartened to know that there's not a long waiting periods for that, like in his own country where he was finding a little bit of a challenge. And it was very cost effective that way, and he could afford that treatment here in India. He was very excited to know that a precise procedure would be performed with the latest robotic means. He decided to come to meet us, whereby I reviewed him with a physical examination in person and reviewed all his reports, and took him up within a couple of days for a minimal invasive spinal fusion procedure. As it's a routine procedure for us, we do close to 100 procedures every month like that. The next day he was able to get up. He was feeling so pain-free, which he told me that he has not felt like this in many years. And from thereafter, his life journey, I believe, has changed, and he doesn't have to bear all the pain which he was bearing before.
I was there for about 2 weeks. I'm saying it's just over a month, and I think this is down to the robotic surgery that I was given. But it was so precise. It ended up being absolutely fantastic from my point of view, and so it's enabled my recovery to be an awful lot quicker. But from reading reports and somewhere usually between 3 and 9 months, and so it would have been near enough 3 years if I'd gone down the original route with the NHS. So this has taken the process from 3 years down to 3 months, and it's just wonderful.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.